All right, it is 12 o'clock, so we are going to go ahead and get started. And people, as they trickle in, just make sure if you can't hear me, make sure you put that in the little chat box. Or if there's any little glitches with technology, just enter that in the chat. I can't see any of you guys, so we're just going to be rolling with the punches. So for those of you who don't know me, I know there's some familiar faces on here, but my name is Rachael Barnette, and I'm a pediatric occupational therapist at our Kinetic Edge location here in Ames. This summer, I'll also be in Pella on Tuesdays. So I've worked in our Des Moines clinic as well. I've been a little bit all over the place throughout the last 4.5 years. But right now I work in our Ames office, and I see entirely pediatrics. So we're going to be talking a lot about emotional regulation today. So just how do we help our kids be calm, cool, and connected? That's kind of our goal. And we'll focus a little bit more too on like specifically what does OT have to do with any of this? And how do we help support these kids if they need additional supports outside of just in the home? All right. So if you aren't familiar with OT, occupational therapy is essentially a profession that's job is to help people engage in what they need to do in a day. So our occupations are what make up our time or what make up our day. They're the things that occupy our time. So if something is disrupting our ability to do what we need to do in a day, an occupational therapist is trained in some sort of intervention to help us be able to do that. So when we think about pediatrics, kids' primary occupations are play, learning, sleep and rest, social skills, and then those ADL skills that we think of. So ADL means activities of daily living, things like getting dressed, brushing our teeth, toileting, feeding, those types of skills. So we're going to talk a little bit about what OT has to do with regulation, but that's kind of our goal when we think about coming back to OT as our basis here is a lot of times kids that can't regulate, their occupations are going to be impacted by their inability to regulate. So either they're struggling socially or we really struggle with mealtime because we just can't sit still long enough to sit at the table and eat. Or transitions are really challenging, whatever that might be. Ultimately, our job is to look back at how does this tie to their function? What is it impacting in their day-to-day life? So there's a lot of different things that can impact a child's ability to do what they need to do. Things like disability or trauma, difficulty with sensory integration. We look a lot at something called retained primitive reflexes, which we'll talk a little bit about today, but that's something that we look a lot at when we evaluate a child. Different environmental factors can also impact a child's ability to regulate, and then things like developmental delays as well. When we think about how we address these skills for kids, play again is how we come back to teaching kids how to regulate or teaching kids how to grow in those skills that they may be lacking in currently. So when we're assessing a child or when we're assessing any sort of individual, we're really looking at all of these different areas to determine where the dysfunction lies. A lot of times it's not just one factor, it's mostly a combination of things that might be working together to impact a child's function. But our job is to figure out where's that root cause and then provide intervention or support at that cause. So we're going to talk about this pyramid quite a bit today. This is just a really important foundation to understanding how kids process information, but then also how they grow and how they develop and how their brains develop. So when we think about function, we think about function in regards to this pyramid. So up at the top of the pyramid, you're going to see academic learning. Academic learning is the most challenging thing we're going to ask a child to do in a day. So their brain is using all of those skills you see listed below on the pyramid to be able to learn. Now, if we think about pulling, like if this tower were a Jenga tower and we're starting to pull blocks out of this tower. So let's say a child has poor awareness of both sides of their body. That's right in the middle at that sensory motor development level. If we take out that Jenga block and we also take out hand-eye coordination, and we also take out, motor planning and think about what's happening to that tower now. As we take out those Jenga blocks, what's going to happen at the top of that pyramid? So we're creating a foundation or we're trying to work off a foundation that's unstable. Okay, so in OT, we work a lot on this bottom level processing, the sensory system level. So if we are having trouble with academic learning or even up there, the ADLs or behavior, we're going to look below that to see where do these Jenga blocks need maybe a little bit of reinforcement, or where are they missing entirely. And a lot of times we end up at that sensory system level. So kids aren't able to take in and organize information appropriately so that they can create an output that's going to look appropriate. We're going to come back to this quite a bit. So I'm going to refer back to this as just our pyramid. But another kind of important thing to think about is like we're constantly building. So kids don't just stop in development if something isn't going right at that sensory system level or at that sensory motor level, right? Development keeps happening. It's just we're building off of an unstable foundation. So when we think about like kids that are maybe really reactive, or like a small problem sets them off to a big reaction, it's probably not that we just actually go from 0 to 100 really fast. It's that our foundation's unstable. And so we're not starting at 0, we're starting at 60. So then, you know, mom told me to get my shoes on and I was building my Legos. Well, that put me up to 70. And now my shoes feel funny on my feet and I don't like that. That put me up to 100 and now I can't regulate, right? So a lot of times these kids aren't just starting at 0. It's not that they're 0 to 100. It's that we don't have the foundational processing skills to be able to handle the stressors that come at the top of that pyramid. All right. So let's get into self-regulation. This is quite the hot buzzword right now, and I feel like a lot of people talk about self-regulation as if it's something we just acquire, right? Like one day we just become self-regulated. And a lot of times I think we misinterpret the word self-regulated for calm. Like a child that needs to be regulated as they need to be calm. And that's not really synonymous. So, what regulated means is we can adjust our level of arousal or our level of energy based on the demands of the task. So, we need to achieve that just right state. So, the example I always give is like if I'm getting ready to go to bed, self-regulated, if I'm self-regulated to go to bed, that's going to look very different than if I'm considered self-regulated to go tailgate at an Iowa State football game. Okay. So there's quite different states depending on what the demands of that task are. If I was falling asleep at, an Iowa State football game, that wouldn't be considered self-regulated. But if I'm falling asleep while I'm laying in bed, that's regulated, right? So we have to think about what are the demands of the task and is the child able to meet said demands? And are they able to flow back and forth between different states? So if we're at the park playing, that requires us to be an increased level of arousal. But then when it's time to get in the car and go home, we need to be able to decrease that to sit in the car and drive home, right? So can we adjust based on the demands of the task? And is that fluid, or do we need a lot of time to adjust? Do we need a lot of warnings to be able to adjust? That's when we would consider maybe self-regulation or regulated to be a challenge for a child. So learning happens best when we are regulated, and that includes social emotional learning. If we're dysregulated, our brain is essentially focused on keeping us safe. So it's not necessarily that if we're dysregulated, we're in fight or flight mode, but if we think back to like the title of this, right, we want kids to be connected. So kids are either in connection or protection. If they're dysregulated, they're probably more so stuck in that protective state. And their body is really just focused on like, how do I get to that just right state? Or how do I get myself back to a place that feels safe? They're not necessarily worried about like what instruction did mom give me or the teacher, or they're not really focused on controlling their body at that moment. So they might be more physically reactive because to them, every little thing might feel like a threat to their survival, when in reality, we know like mom asking me to put my shoes on doesn't mean anything to my survival. But in their little brains and bodies, when they're operating from, again, that unstable foundation, and they're primed to jump into those reactive states, that's our brain's way of trying to keep itself safe because it doesn't inherently know that, like, okay, I can handle the demands of this task. So we can't do connection and protection at the same time, right? We can't be in both modes together. So really, when we're thinking about getting kids back into connection, that's where we're going to talk about these tools and strategies that we use, just to help. It's really body focused, right? How do we get their bodies back to a just right state? Their brains will follow after their bodies are more regulated. Another really key component here, there's a great book, I included it at the end, but it's called Raising Kids with Big Baffling Behaviors. And in that book, they talk a lot about self-regulation and how it relates to co-regulation. So we're going to talk about co-regulation as well, but co-regulation just means our ability to regulate with each other. So as babies and as infants, we are learning how to co-regulate with our caregiver. So if mom is stressed, baby is stressed, right? So even in the womb, like babies can interpret increase in heart rate, or if mom is flooded with cortisol all the time, well, that's also being sent to baby. So there's impacts on our ability to regulate based on our own caregiver's ability to regulate. As we co-regulate over and over and over again, so I get upset, mom or dad comes to help comfort me, or teacher, whoever it might be. As we do that over and over and over, and we build this connection in our brain that says, like, okay, when I'm upset, here's what mom does to help me calm down, or here's what dad does. Or when I'm upset, here are the things that I know comfort me. As we build that connection over and over, we create like a highway in our brain. And when we have that highway, that we call it, like, it's internalized, right? We know it's there even when our caregiver's not there. A situation can come up and we know that that pathway is strong enough that it can activate even when a caregiver is not present. So self-regulation is really just co-regulation that's been internalized. If we haven't figured out how to co-regulate, we're probably not going to be able to self-regulate. Okay. A key component here as well, I'm going to go back to Raising Kids with Big Baffling Behaviors. In that book, they break regulation, or just like the states that our brain can be in, into 3 different characters. So one of them is called the wise owl. So this would be more like our executive functions. We are, we're still aware of what's going on around us, but we're thinking ahead to the future. We're planning, we're organizing, we're thinking about like problem solving and logical processing. So those are our executive functions. The other character would be the protective watchdog. So it is exactly what it sounds like. In our brain, this would be like our amygdala. So the wise owl is like our frontal lobe that handles all of those executive functions. Protective watchdog would be like our amygdala. So it's scanning for danger, right? Exactly as a watchdog does. So this is what activates our fight or flight system. And then the possum is essentially what like plays dead when we're in a sense of danger. So it is exactly what a possum sounds like. If we think about how kiddos react when they're dysregulated, you can kind of see a lot of times they'll go into that watchdog state. Well, they'll become loud or aggressive or like manic almost, where they're just like, you can see it. They're in fight or flight and they're just everywhere. They're trying to protect themselves. Or you can see the opposite become true, where they're in that possum mode, where they'll kind of internalize. They might go silent. They might not be responsive to you. So that's more of that like play dead possum type state. So protective watchdog would be like a high arousal, and the possum would be like our low arousal. Whereas we want to be in our wise owl state. We want to be in that like just right regulated state. Okay. All right. It's important to understand why kids become dysregulated in the first place. If we don't understand why they're there, we can't really help them get out of that state or prevent them from getting there in the future. One thing that we always have to keep in mind is that we all get dysregulated, right? It's not abnormal for children to be dysregulated from time to time. Dysfunction really occurs when that dysregulation is extreme in frequency, intensity, or it doesn't match the stimuli. So somebody bumps into me getting in line for school and I turn around and punch them, right? The situation and the reaction don't match. that's where that starts to become a little bit more problematic, or where we would consider that to be dysfunction. A lot of times issues with regulation comes from one of these four categories, and not always. There's, things that are kind of one-off situations that wouldn't maybe fit into these boxes, but sensory processing challenges are a huge impact to our ability to regulate. If we think about that pyramid again, at the very bottom of the pyramid was our central nervous system, so our brain and our spinal cord. But right above that was our ability to process sensory information. So if we're not taking information in and organizing it appropriately, we're not going to be able to create an output that looks appropriate. Retained primitive reflexes are another one that I mentioned earlier. So really, to give like a Cliff Notes explanation of this, we all have reflexes that exist in infancy, usually in that first year of life, that help us develop protective responses. So like if I fall forward, my arms should come out in front and catch me, okay? There's also reflexes that don't last beyond that first year of life. So we use them in that first year of life to help connect different structures in our brain. They create those neural highways. And then those should what we call integrate, meaning they mature, and then we don't see those reflex patterns anymore. So those reflexes exist in our basal ganglia, which is a very primitive part of our brain. It's down low in our brain, which means that it handles a lot more primitive functioning, like fight or flight responses, or like our just basic automatic responses. So like breathing, heart rate, all of that stuff. The basal ganglia does movement specifically, but again, it's in that lower level brain center that handles more of those just automatic functions. So if a child is getting information coming in and it's only getting to here before their body is kicking out some sort of reflexive response, it's not making it to the parts of their brain that are logical and rational so that they can make a decision based off of that input. Their body's reacting before their brain has a chance to process. So that's a huge piece of what we work on in therapy and what we assess when we see kids for OT. A lot of times the brain-body connection or coordination can also be off. So when kids lack physical grounding and stability, that's going to impact their ability to emotionally ground and stabilize. And it seems kind of silly, like, okay, why are you working on, balance and coordination with my kid who's explosive? But if we really think about it, emotions are so abstract, right? We only know we're experiencing an emotion because we can feel it in our body. So if a child has no ability to determine what their body's feeling, where their body is in space, they can't tell that they need to go to the bathroom until it's an emergency, or they don't know they're hungry until they're starving. How are they supposed to know that they're frustrated before they're angry, right? We have to teach them how to be in touch with their body so that they can then interpret those cues a little bit more appropriately and identify when they're starting to become dysregulated before they get to that point of no return. So when kids are at 100 is not when we want to start trying to walk them back down to 0. We want to try to catch that before it gets to that extreme. The last one can be poor attachment to caregivers or lack of co-regulation. So for kiddos that have a history of trauma, neglect, or abuse, it's not always that extreme either. So trauma can look like medical trauma. C-section birth is one that we see often that impacts sensory processing as well. And can impact our ability to regulate. Trauma is so subjective. So if in your head right now you're thinking like, oh, those kids, that's not my kid, or that's other people, that's not anything that we've experienced. We never know what might be traumatic to a child. So it's not to rule that out, and it's not to say that every child has trauma, but also it's more common than you would think that kids hold on to things that have happened before they're even capable of remembering those occurrences, and that their body's still kind of stuck in that fight or flight response, or just that heightened state based on what might have happened to them. Over on the right, there's a couple signs that a child might be emotionally dysregulated. So big emotions or reactions that don't match situations, which we've talked about, drastic mood swings from one extreme to another. A lot of times we see kids that have difficulty naming their emotions, or they can name emotions, like they can tell you emotions are happy, sad, angry. nervous, but they can't apply them to themselves, or they can't think of situations in which they've ever experienced those emotions. Excessive crying or whining, as well as frequent aggression. Often these kids are irritable or might snap. They can be impulsive or have difficulty making decisions. And then they might get stuck in these worries and just have a hard time pivoting to thinking about anything else. Another key here too is just thinking the difference between dysregulation and disobedience. We hear this so often in our office, like, well, I've told them what to do and they're just being disobedient, right? So kids aren't inherently manipulative. Their behaviors aren't here to torture you. It might feel that way sometimes, but a lot of times kids don't have the verbiage or the skills to be able to communicate their dysregulation. So the best way they can do that is through their behavior. And a lot of times we might miss those cues early on that were telling us like, hey, something might be going on here. And then they get to this extreme and they're super dysregulated. And now we're trying to bring them back down, like I said, when they're, at 99 or 100, which is really challenging. And that's, hard as it should be for all of us. But that's their way of expressing that they're struggling too. So a lot of times we need to identify the root cause, one, of that emotion, but then also think back to like, have I upheld boundaries? Am I consistent in upholding these boundaries? Does the child know what the boundaries are? And if so, if you feel like, yep, I'm really consistent in, explaining my expectations to the child, and the expectations are reasonable based on their age and their developmental level. I'm being consistent with those boundaries and I'm being consistent with consequences. If that still isn't working, if you're still seeing the same behaviors, then it's probably a sign that something bigger is going on and that it's not just disobedience. That's true dysregulation at its core. All right. Okay. This is another little picture that we're going to come back to quite a bit at the very end. So this little picture just explains how we process information. And we're going to talk about it in a different context later on. But for now, we're going to talk about how we process. So starting left to right, we'll see taste and smell is over on the left-hand side, auditory information on the right. As we move from left to right, we get from most simple input for our brain to process to most complex. Okay, so tastes and smells are very simple. Auditory input is very complex for our brain to process. As we work our way top to bottom, we go from calming to alerting. Okay, so sweet vanilla tastes and smells are going to be more calming than bitter and smoky tastes and smells. Makes sense. Okay. Now, I always point this out as well. Oftentimes when kids are struggling or when they are not doing what we need them to do, we'll jump down to language, which we can see is all the way down at the bottom right-hand corner. So it's the most alerting and complex input that we can give to a child. We're going to talk about sensory processing right after this. So hopefully this will make a little bit more sense. But when we think about trying to talk a child out of a meltdown, their brain is so far from being in a space to be able to handle that. A lot of times we need to go farther to the top and the left-hand side of this chart to be able to reach them. And then we can start to work our way back over to language. But that's not where we always need to start because they're just not equipped to be able to process that at the time. Okay. All right. So we talked a little bit about sensory processing, but really sensory processing, like I said, is our ability to take in information and organize it so that we can make sense of the world around us. So there's 8 different sensory systems. Most of us know the first 5. So touch, sight, smell, hearing, and taste. There's 3 others that we also use all day, every day that we're probably less aware of. So proprioception is our ability to know where our body is in space and in relation to itself and others. So that's more of like our body awareness. Vestibular processing is our ability to process movement of our body. And then our interoceptive sense is our ability to interpret internal information. So when I was talking about earlier, kids who have a hard time processing if they're hungry before they're starving, if they need to go to the bathroom before it's an emergency, if they're frustrated before they're angry, these would be our kiddos that struggle with interoception. So they're not able to interpret the body cues that they're getting before they're extreme. Their body needs a lot of information before it's telling them, hey, there's something to pay attention to here. So that is what we would call like our sensory threshold. So the threshold is the amount of input needed to generate a response. We all have a different level of threshold. So, and it might even depend on the type of input. For me, I am somebody that if I'm going to do my best work, if I'm going to focus and really get work done, I need to be somewhere that's actually a little bit loud. I need noise, I need movement, I need things going on around me that helps me stay focused. So, in that sense, I have a very high threshold. I need a lot of input for my brain to feel focused, alert, and calm. Okay. Now, on the opposite end of that spectrum, I am very sensitive to tactile input. I don't like touch. I'm picky about how clothes feel on my body. When I was younger, I was a super picky eater. So there's different ways that our brain processes information that might be dependent on the system. It might be just as a whole. So if a kiddo has a high threshold, it means that they need a lot of input before their brain is generating a response. I'll give the example of like somebody who maybe walks into a room and just doesn't seem to notice, like, oh, hey, I didn't even notice that there were, 5 people sitting in the chairs over here. I just walked right past them and sat down in a different chair. Their brain didn't interpret that information as important enough to trigger a response versus somebody with a low threshold might be able to walk in the same room and see like a little grain of salt on the floor, right? We have kids that come into our office all the time that finds a grain of rice that was on the floor that the vacuum missed, right? Their threshold's very low. It doesn't take a lot before their brain is saying, hey, there's something to pay attention to here. So this can impact our ability to regulate. There's 2 different sides of this. So for each threshold, there's kids who regulate passively and kids who regulate actively. So I'm going to give examples of both active and passive regulation, as well as what this looks like for each threshold. So for the small hand-built mug, these are kids that have a low threshold but are passive regulators. So they have very low threshold for information. They're overflowing more often than they should be, meaning they're going to notice everything. I like the example it gives, so they can feel the tag in a shirt while someone else is wearing it. Now, because they're passive regulators, these kids aren't kids who are going to have like giant reactions to those things. So it is exactly what it sounds like. They're very passive. So they may appear to be more like zoned out. These are our possum kids. Okay. These are our like withdrawn, maybe just overstimulated, but they're overlooked in a classroom or they're overlooked in a group of kids because they're generally not super defiant. They're not actively avoiding the input. They're just kind of dysregulated, but they're there. Whereas the little teacup are going to be our active regulators. So these kids have a very small cup, similar to the passive regulators, but these kids are going to tell you when pretty fast. So these are the kids that maybe will actively elope or avoid situations where they're overstimulated. They love routine and they're usually pretty insightful about what they need. So very responsive to input. On the opposite end of this, our high threshold kiddos, we still have that passive and active regulation, but our passive regulators have a big cup and they can't be bothered to fill it. So again, these kids in the high and low thresholds, but passive regulation look very similar. This is where we dive in to really figure out like which side of this coin do we fall on, or maybe we fall on both in certain situations or with certain input, but they easily overlook sensory input. They're pretty good at focusing, but these are kids that just generally are pretty unaware of things that are going on around them. So where did that bruise come from is the example that they give here. these are the kids that just, you have to say their name 5 times before they seem to even notice that you're speaking to them. They need a lot of input before their brain is saying like, hey, there's something to pay attention to, but they're not bothered to go out and seek that information. Whereas the tall mug, these are going to be like our sensory seekers, our kids that are eager to fill their mug and need a lot of input and are going to do whatever they need to get that input. So constantly moving, constantly touching things, putting things in their mouth. The example they give here is steals your pen, clicks your pen, breaks your pen. They're just usually a little bit more what we would think of typically as like hyperactive. So those are a little bit easier to spot than those passive regulators. When we are working with kids within OT, our goals and intervention include organization, integration, and remediation. So organization just means we're helping them regulate their nervous system to be able to achieve that appropriate level of arousal. Integration would be like getting all of those senses to work together to create more conscious control over our body and brain responses. So like I mentioned earlier, we're not stuck in our basal ganglia. We're able to operate from that frontal lobe and actually problem solve and reason. And then the last one would be remediation. So we're trying to remediate those functional skills, including the use of regulation strategies. All right, now we get into the good stuff. So intervention strategies that we use are kind of based in these 4 categories, or 5 categories, I should say. We use a lot of proprioceptive input for calming. We really want to work on building self-awareness and that interoceptive processing, so identifying how our body is feeling. Parent coaching is also a pretty big emphasis as far as like, we have to be able to co-regulate again before we can self-regulate. And that starts with caregivers. And then physical grounding and stability. So building those foundational processing skills, those body awareness skills, getting both sides of our brain and body working together. And lastly, reflex integration is a huge piece of what we do as well. So as far as proprioceptive strategies go, heavy work is something we use a lot of, and there's going to be another slide right after this with some heavy work strategy ideas if you guys want to take a picture or screenshot or whatever it might be. But these are things like pushing things that are heavy, pulling, climbing, jumping. So we're going to talk about deep pressure input here in a minute, but deep pressure, so like deep pressure squeezes, not just like gentle little pinches, but deep pressure squeezes are very calming. That proprioceptive input is very calming for our body. And heavy work essentially gives us that input without having someone else have to give it to us. So for kids that are dysregulated or that are emotionally reactive, more often than not, if you said, hey, come here, let me give you a big hug or let me give you some squeezes, they're not going to let you, right? So heavy work is a way that we can get that same benefit or that same deep pressure input, but they're doing that by activating those larger muscles of their body. So they're holding that activation. And when they release that, it helps release dopamine and endorphins and all these happy chemicals to our brain that help us calm and regulate. So like I mentioned, deep pressure is another strategy. So things like weighted blankets, deep pressure massages or squeezes, joint compressions. So joint compressions, I go back and forth with, they're kind of if you know how to do them, great. But all a joint compression is you're giving a little bit of traction to the joint. So I'm pulling away and then pushing together, pull away, push together, okay? When we're creating that deep pressure within the joint, that also helps to release those dopamine and endorphin happy chemicals to our brain. Things like rolling a child up in a blanket like a burrito. Again, we're giving their body that deep pressure, but it's in a way that's a little bit more silly and a little bit more play. Getting kids to lay on their belly or allowing them to stand to complete a task. Standing isn't necessarily deep pressure input, but when we're getting them on their belly, they're getting a lot more input to a larger surface area of their body. So right now I'm sitting to give this presentation, but if I were laying on my belly, I'm not only getting input to my bottom and the bottom of my legs, I'm getting it through the whole front of my body. So if children have trouble knowing where their body is in space, or if they're just generally all over the place, sometimes getting them down onto their belly can be nice because it forces them to get input to more of their body. And then rhythmic movements are another key component here as well. So things like swinging or marching to the beat of a song, clapping to the beat of a song, something that gets them pairing some sort of rhythm with their own body. Ideally, if we think about like a child's resting heart rate, it's usually between 50 and 70 beats per minute. So if a child is dysregulated or is escalated, it's probably going to be quite a bit higher. So if we start a little bit higher and then start to build in like slower, slower, slower music, or maybe I start and I'm just going to say like, I'm going to clap and I want you to try to hop every time I clap and give them a pace to match and then slowly bring that down slower and slower. That's going to help bring their heart rate down. It's going to help bring their just general overall arousal state down as well. Yoga is a great one, especially pairing it with counting. Again, it's creating that rhythmic input. That can be a tricky one too if you have kids that just generally are like, no, I'm not going to do that. You know, they might be a little bit more invested in something like swinging or some of the heavy work strategies. So it's finding what works best for the kiddo. That might change even depending on the day. So what works one day might not work the next day. So part of our job is to be flexible. The last one is oral motor input. So a crunchy snack, gum, blowing bubbles. Puffer cheeks are one that we teach kids in here sometimes. So just puffing up your cheeks like a puffer fish. It gives that same heavy work or deep pressure input to the mouth. I always encourage parents too to think back to like, if this child was a baby, how would you calm them, right? So you might give them a pacifier, you might rock them, right? So again, swinging, giving them a crunchy snack, or even just giving them like cold water. Temperature can be a great regulator as well. So when we're escalated, usually our body is hot. Giving us something cold can help cue our brain and body to come back down from that escalated state. Oral motor input, if we think back to that sensory motor planning worksheet with all the boxes, that taste and smell input is the most simple input for our brain to process as well. So you're not likely to overstimulate a child by trying to give them something oral motor to focus on when they're in that state as well. All right. As I mentioned, these are some of the heavy work strategies. So things like body support exercises that give the example of planks, push-ups. We do a lot of animal walks in here. So bear walk, crab walk, things like weighted items. So putting things in a backpack for a child to carry or weighted blankets. If you have a laundry basket, putting things into a laundry basket and having a child push it down the hallway. Deep squeezes are on here. Chores, that's kind of a hard one to get kids to do when they're dysregulated. So maybe don't push that one too hard, but jumping jacks, hopscotch, trampoline. And then as we mentioned, like pushing, pulling, or carrying things that are heavy. On the other side, there's just an example of some strategies to help calm. I always encourage families like have these accessible and talk about this list or find some strategies and have pictures of them and talk about them with the kids when they're not dysregulated or when they're not in a highly emotional state. Kids need to practice these things just like they would need to practice any other skill. So talking about them and practicing them helps reinforce to their brain that these are available strategies so that when we do escalate, we know that they're there and we've used them before. It's not unfamiliar. It's also important to have photos or have pictures because, again, thinking back to that sensory motor planning worksheet, visual information can be very overstimulating for children. So looking at a picture is going to be a lot easier for them to identify something and select than looking at words and having to read. The demands on our brain are just a lot more. So having pictures that they're going to understand exactly what it means is helpful as well. All right. The next intervention piece we talked about was self-awareness. So this is where we get into teaching kids body awareness and interoceptive processing. So on the pyramid, body awareness and body control precedes all of our conscious thought processes and our behavior. So that includes like emotional regulation. As far as activities go, having kids engage in a lot of sensory rich play and talking about what it feels like in our body while we do so is a great way to get them thinking about how their body is feeling. So if I'm playing in kinetic sand, that's going to feel very different than if I'm playing in water beads. So maybe while I'm doing that, I'm talking about like, oh, how does it feel in your hands? Like, do your hands feel cold? Do they feel warm? Do they feel soft? Do they feel grainy? Right? Getting them thinking about that is important to start external, right? So starting with something like our hands and our feet and working our way to our emotions is going to help them be able to internalize that a little better. If they struggle with even identifying how their hands and feet feel, it's going to be really hard for them to identify how emotions feel within their body. So that's kind of our starting point. Another way to build interoceptive awareness is something called the heartbeat challenge. So you're just going to notice your heartbeat at rest. A lot of watches and things now have like a heart rate tracker. So that's pretty cool. Kids think that's pretty cool. If you have something like that and you can even like see the number of their heart rate and explain to them, like the faster you go, the higher your heart rate's going to go. So noticing what that is at rest and then having them run or jump for 30 seconds to a minute, see what it is then, and then have them take some long, deep breaths and notice what their heart rate does. So, again, we're teaching them how these strategies help. It's not just telling them, like, hey, when you're angry, take deep breaths. That's going to help. That has no anchor to kids if they don't understand why it helps or if they don't feel that change in their body. So, giving them that, feedback or that concrete evidence, right? Like, here's what your number was, and here's what it is now after taking deep breaths. It helps them buy into the process as well. We do a lot of obstacle courses with our kids that come in for OT. So we're really trying to emphasize like balance and body awareness and regulating our movement. So again, thinking back to body awareness, if we can't regulate our movement, how are we supposed to regulate our emotions? So we really start whole body and then work our way down into like more intricate and more specific skills like emotional regulation. Next would be building an emotional vocabulary. So this would be something that that follows that interoceptive awareness and that body awareness. So talking about and identifying how emotions feel in our body. So even noticing it for them, like, hey, I wouldn't do this in the moment. I would wait until this is, the moment's passed. But hey, when you were upset earlier, I noticed your cheeks got really red. Did you feel that? Could you feel that in your body? Or I noticed that when you were nervous, you started to get a little wiggly. Like, what did you feel in your body? And talking to them about what that experience feels like, or even what you feel like, hey, this thing happened today and I'm pretty frustrated about it. And you know how I know I'm frustrated? Because my hands feel tight and I'm squeezing my teeth together. And I think I'm going to go get a crunchy snack because that might help me feel a little bit better. So narrating our own ways that we regulate is a great way for kids to help pick up on those things and actually internalize them a little deeper. We do this all day, every day. We just don't talk about it as much as maybe would be helpful for kiddos that really struggle with these skills. So um, again, identifying those cues for yourself and others. So identifying how you notice those emotions, as well as teaching what emotions feel like versus just the words themselves. We have so many kids that could name every emotional word under the sun, but they can't tell you what that feels like, or they can't tell you like situationally when they experience that. Maybe they can tell you like, okay, well, I've heard like I'd be angry if someone stole something of mine. But if you ask them, like, has that happened to you? When have you felt angry? They have a really hard time tying it back to some sort of experience in their own life. There's also some self-awareness strategies over here on the left. So setting a positive example is a huge one. Letting them try new skills and activities, giving them room to fail and supporting them when they do is a huge component as well. Encouraging them to follow their hobbies and passion, talking about the challenges they face, just really creating open communication. helping them determine their strengths and weaknesses. This one I really like. And a lot of times we try to be super strengths based, which is wonderful. We do need to talk about kids' strengths, but identifying where things are maybe challenging for them and talking to them about, like, here's what's challenging for you, here's what's challenging for me. And just again, creating that open dialogue of like, we all have these things that are challenging and maybe not, we're not the superstar at, can help them just understand that like when things do go wrong, they have the tools and skills to be able to handle that. And things are going to go wrong, right? Setting that expectation that things are not always going to be perfect can be really helpful as well. Talking about their weaknesses and then strategies to overcome is kind of, yeah, the key there as well. Avoiding comparison with others, and then providing opportunities to be independent is really important as well. It goes back to allowing them to fail. So teaching them how to fail with grace and fail forward. All right, so coming back to this, when we think back to this pyramid, we can see down here at the bottom, we've talked about sensory systems, we've talked about like body awareness, that perceptual motor development. These are skills that we also work on with kids, but when we get to building that self-awareness and actually teaching kids how to use self-regulation strategies, that's up there at that behavioral level or at that daily living activities level. So it's pretty intense, and that's pretty challenging, right? So as far as like thinking about OT compared to talk therapy or play therapy, where one, the best combination of addressing emotional regulation, if you feel like, okay, my kid's really struggling, would probably be a combination of things. So where we're really bottom up working from that baseline sensory system level, someone like a neuropsychologist or a psychologist or a play therapist is going to work more on those cognitive intellect skills. So they're going to work like bottom down. So that's kind of where we meet in the middle. And I just want to give a little caveat there because I think sometimes people have a hard time understanding like, okay, where are the differences between like what you guys do in OT and what their play therapist is doing or what like a talk therapist might be doing. So we're really starting at that bottom level and working our way up to regulation versus starting at regulation and working our way back down. Okay, the last little section, actually not the last, the second to last, would be parent coaching. So co-regulation, like we've mentioned, is such a huge piece of the puzzle. So your body is a tool to regulate your child. Physical connection, deep pressure, massage. I included tapping on here and bilateral stimulation. So essentially all that is giving the kid, like it sounds like, bilateral stimulation, left, right, left, right, left, right, left, right. Our brain really likes symmetry and it really likes rhythm. So when we're giving that tapping input, it could be to any part of their body. I often find myself doing it on my lap or on my legs if I'm sitting at my desk, but that left, right input for about 10 to 15 seconds, followed by a deep breath, can be very regulating. And it's regulating for you too as well, even to give the taps. Modeling and verbalizing your own regulation strategies, as we've mentioned. Really being aware of your tone of voice and body language. So if you're trying to increase the arousal of a child, you might need to increase your tempo or increase the tone of your voice, or maybe be a little bit more sing-songy. Versus if a child's escalated and we need to de-escalate them, we're probably going to have to get a little quieter, a lower tone of voice, and lower our body. No empty threats. That is one thing I really want to harp on. So kids really love predictability. We all do. Our brains are wired to look for predictability and patterns. So when we make an empty threat or we set an expectation or set a boundary that we do not uphold, that decreases our predictability. So that's going to increase dysregulation and then decrease the child's trust. So just something to be cognizant of. If you find yourself making a lot of empty threats, just be aware of like, there's a reason that's probably not working for you. So instead of making empty threats, like instead of, if you do that, we're not going to go to the park today. But really, you're going to go to the park anyway because mom needs a break and kids need to run around at the park. Instead of saying that, like, hey, when we get to the park today, you're going to have to sit on the bench with me for 2 minutes before you get to go play. Okay. So you're going to sit with me. So that's something that you can actually control once you get there versus just making a global empty threat that isn't going to happen. Strategies to increase predictability or routine would also be a way to help kids regulate. So discussing changes in routine ahead of time, providing some sort of daily schedule or visual schedule if they seem to be concerned about what's coming next throughout the day, giving kids control over parts of that routine. So maybe you don't get to choose when breakfast is, but maybe you get to choose what you have for breakfast. Kids will hold on to pieces of control. If we think back to that pyramid, if the lower levels of their pyramid is not steady, they're not feeling in control of their environment. They're not feeling in control of their own body. So they're going to cling to whatever pieces of control that they can find. And then also talking about calming strategies ahead of time and practicing. Natural consequences would kind of go back to that empty threats as well. So the consequences that you provide should match the situation in both context and severity. So if a child, let's say, throws something at me, let's say they come up with their, I don't know, some sort of toy and they throw it at me or hit me with it, the consequence to that being like, okay, well, we're not going to the pool later now. That might not match in severity or in context. So the child's going to have a hard time attaching that behavior to the consequence because it just doesn't match. Versus if I say, like, oh, you can't be safe with that toy right now, so I'm going to keep it and we'll get it back when we can be safe with that. That's exactly tied to what happened there. That toy was not safe, it was a weapon. So now I lost that toy. It's a little bit more of a natural consequence. We want to put kids in situations where they can be successful. So putting them in situations with maybe lower stimuli or with lower demands, and then building in those demands or expectations as they're successful is going to increase their ability to regulate as well. So it may seem like, okay, well, they're 6. I don't want to treat them like they're 4. But sometimes you need to work backwards to be able to move forward. So putting them in situations to build their confidence is going to help them regulate in the future as well. The last one, I'm just going to kind of fly through so we have time for questions here, but reflex integration is something that we work on a lot in OT. So reflex is an automatic response to a stimuli. So like we talked about earlier, these primitive reflexes develop when we're in utero and they mature throughout that first year. So if there's delays in that integration of the reflexes, that can cause challenges higher up that pyramid as well. So cognitive processing, body awareness, and emotional regulation. All of our OTs are trained in assessment and integration of primitive reflexes. So it's something we look at and we take very seriously. And a few examples here would be the Moro reflex. So this is like our infant startle response. So this is why we swaddle babies. If they're sleeping or they're laying down or you go to lay them down and their head tilts back, you'll see them kind of go into this like stress response. So kids that maybe didn't integrate that reflex or have dysfunction in that pattern, we'll see a lot of thrill seeking without concern for safety. We might see excessive worry or poor sleep patterns, poor concentration. A lot of times they have what we call gravitational insecurity or fear of their feet leaving the ground. And then difficulty with decision making and a weakened immune system. Weakened immune system because they're just stuck in a chronic state of fight or flight. So if your body is stuck in fight or flight all the time, it's really not worried about fighting off, the common cold. It's just worried about making it through the day. So the other one on here would be fear paralysis. So this is like our adult startle response. So this is in response to some sort of environmental stimuli. So if somebody were to come bang on the wall behind me, that's an auditory stimuli from the environment that would startle me or put me into a fight or flight response. If kids have an overactive response to this, we'll see that they're overly sensitive to touch, sounds, or visual information. They might have an overactive gag response and likely be a picky eater. They often dislike having their vision occluded, excessive anxiety or poor tolerance to grooming and hygiene tasks. They're easily distracted and then have stiff body position. There's a couple more too, like hand supporting is one we work on a lot with our kiddos that struggle with regulation. So this one is like, if I fall, my arms come out and they can catch me. So if we don't have that innate sense of self-protection, we're probably gonna, overcorrect in the opposite direction and have negative patterns of self-protection. So kids that have retained that reflex often have poor social boundaries. They might be easily targeted and a lot of times have poor physical boundaries as well. And then foot tendon guard's another one that I thought of. So this one has to do with just like rigid thinking, poor concentration, and poor self-confidence. All right. I'm going to go back to this here. If we're thinking about this little worksheet, I like to think about it, one, as a guidepost for like what types of input should we be giving to kids when they're dysregulated, but then also like what types of input are they getting throughout the day? A lot of our school age kids are spending a lot of time over here on this visual and auditory information. So by the time they get home, they might be a little bit burnt out from these areas. So we need to focus on giving them input over here. So maybe we give them some sort of tactile activity like kinetic sand, or like we're going to let them go outside and play in the grass. Or maybe we give them some sort of oral motor input like a smoothie, or vestibular input, like I'm going to let them swing, right? So thinking about like, where are they now and what type of input do they need to get where they are at a just right state for whatever it is we're about to do. On the opposite end of that, if they're very lethargic and in that like low threshold or low arousal state, we might need to give them a little bit more high intensity input on this right-hand side to be able to increase their arousal. Here are just a few additional resources. So some books and podcasts. The first two are books that are written for parents. The first one is that Raising Kids with Big Baffling Behaviors that I mentioned. And all of our OTs have read that, and we absolutely love that book and highly recommend. The Explosive Child. I really like My Body Sends a Signal. This is a book that's meant for kids, excuse me, to help them learn about what emotions feel like inside their body. And then Good Inside is a podcast for parents. Little Kids Big Hearts is a podcast that is geared for kids to help them learn regulation strategies. All right, well, I cannot see or hear any of you, but if there are questions, I will open up the chat for questions. We've got about 2 minutes. We'll try to hustle through. I also on here listed each of our clinics. So if you guys have questions, comments, concerns, feel free to email me or give any of our clinics a call. These are our clinics that offer OT services. So we have a few other clinics, but those do not offer OT services at this time. All right, well, I'm not seeing any questions in here. So, oh, I see a hand raised. Let me see if I can figure out how to let you talk. It might be easier if you guys can put in the chat. Okay. Okay, let's see. There we go.
I don't know if you can hear me. This is Gina Barkus. I think I'm
I can hear.
doing this right and clicking in the chat, but it says chat disabled.
Oh, okay. Well, good to know. I did not know that. So yeah, if you want to ask, maybe just raise your hand and I can unmute you.
Well, that's all right. This was so good. I can't thank you enough.
Thank you. Yes, of course.
My daughter takes my granddaughter to the Newton Clinic and just really has grown leaps and bounds with her sensory issues.
Awesome.
So, but she couldn't do the seminar because it was during work hours for her.
Yes.
She's
this
like,
is being
Mom,
recorded, so we post them all on our YouTube channel.
Super. Awesome.
So, yes.
I will let her know that. Post it on the YouTube channel. Well, I did a few screenshots of your stuff and took a million notes. So between the YouTube channel, all my
Yeah,
scribbles, I'll connect with my daughter. And again, just thank you for offering this. I'll let
of
somebody
course.
else
Thanks for
talk.
being here.
Hi, this is Brenna. I was just wondering if those slides would be available. I tried to take a few screenshots also, but would love the slide deck.
Let me talk to our marketing gal. She would be the one to send it all out to participants. So yes, I can make that available and I'll just send it to her and then she'll try to get them out to you. But um,
Perfect.
yeah,
Thank you.
I'm gonna make a note so I don't forget to do that.
Thank you so much.
Yes, of course. Hi, Jessica. I think you're unmuted now.
Okay, thanks. I just had a quick question about like a referral.
Yeah,
Does a child need a referral from like their medical doctor or
sure.
therapist?
It depends on the insurance. So if you have any sort of state insurance like TRICARE, any sort of Medicaid or Medicaid if it's a secondary, we do need a referral from the primary care doctor. If you have like United Healthcare, Blue Cross, any sort of like private insurance, we usually do not need a referral. That's something if you called one of our offices, they could double check and confirm with your insurance that you don't need a referral. Um, it never hurts to have, but we don't usually need it unless it's state insurance.
Okay. I'm a psychologist and I think it would be super helpful for some of my clients to be able to work with
Yeah,
you guys too.
yeah. And we take every type of insurance for the most part. I think there's like one weird United Healthcare plan that I've never seen it come up, and I've worked here for 4.5 years. But otherwise, we take everything. So,
Perfect. Thank you.
yes, thank you. Alyssa and Hannah, I tried to unmute you guys. So whoever has a question and wants to ask first, go for it.
I just wanted to say thank you so much. This was really helpful information. My son has ADHD, and I see a lot of the things you're talking about in him. So
Yeah.
this was
Yeah. Well, thanks for
very
being here.
helpful.
Yes, of course. Kelly, I just tried to unmute you too. There you go.
Oh, here I am. Can you hear me now?
Yes.
Okay, perfect. I missed the beginning. I'm so sorry. I lost track of
No worries.
time.
That's okay.
My daughter's almost 4, and we've been talking to her pediatrician a whole bunch because she has
Mhm.
behavioral things come up, and I'm a past educator and have a lot of experience with it, but it's been a real
Yeah.
struggle. So we
Yeah.
are starting we have a family history of ADHD and
Mhm.
pretty severe cases. So we are starting like the GUABA, whatever the
Oh,
one.
Guampacine?
Yes, we
Yep.
literally are just starting that this week, but I mean, like the other morning we had a 2-hour tantrum because it started with her sock fell off and then it
Yeah.
spiraled.
Yeah.
Every time I would like, I'd see it come in and I try to talk her down.
Uh-huh.
I'm like, oh, we can fix this. And, you
Yep.
know, then it just goes and then she about comes off of it 20 minutes later. And then something else, just the smallest thing, her brother grabbed the wrong toy. She starts
Mhm.
again. In the middle of those tantrums, we have yet to find anything that will help her calm down.
Yeah.
Would that be where we would utilize like the bilateral tapping thing? Like what would I do
Yep.
in the
Yeah,
middle?
it can be. It can be.
Okay.
It really depends on the kid, like what they're willing to accept at that time. A lot of times when they're in that state, so we always say like our goal is to try to avoid getting to that 100, right? Like obviously there's going to be times that happens. We as adults still get there sometimes, but we want to try to avoid getting there as much as possible. So if we can teach them skills that they can use when they're at a 50 to get them down to 30 so that like the sock falling off doesn't take us to 100, that's our primary goal. But When we're to 100, if they're willing to accept tapping, great. That's usually when I would recommend, like, if some sort of distraction, like, usually how mom reacts in that situation is like, mom tries to talk me out of this, and or mom might, I don't know, however you normally respond to that. Sometimes the best distraction is reacting in the complete opposite way. So instead of trying to talk to us about this now, I'm going to turn on some music and I am going to just like groove it out next to her, like, if depending on what the situation is, obviously if we're overstimulated, adding in another stimulus probably isn't the answer. But let's say we're just having one of those days where we're just in a meltdown. Responding in a way that's light and in a way that's like, this isn't that serious, it's going to help them see that this isn't that serious versus trying to explain to them that it's not that serious. Just because they're not in that part of their brain where they can even hear that and process it at that time. So sometimes doing the unexpected, or even like, okay, if we're having a hard time transitioning from, the kitchen to the front door to be able to get our shoes on and go wherever we need to go. Maybe now I'm going to get a blanket out, and transitions are going to be like, I'm going to plop her on the blanket and I'm going to pull her where it needs to go. So I'm giving a different type of input. It's not auditory input now. I'm not trying to talk to you when I'm not playing music, but it's movement input. So it's like working farther on that left side of the sensory motor worksheet. And a lot of that can be just like novelty, which it's hard to create novelty over and over again. But I would say like the biggest thing is like keeping yourself regulated in those moments, because she's going to feed off of whatever it is that is experienced or what's happening around her, right? So if I'm dysregulated and I'm trying to de-escalate a child that's dysregulated, we're just dysregulating each other at that point. So if that's where you find that you are, there's nothing wrong with taking a step away even and saying like, I'm overwhelmed. I need a second, and setting a timer, having like a sand timer. We have these like visual timers that we use a lot. So you just turn it and it shows them. So even warnings for transitions. So if transitions in general are hard, like we're going to have to put our socks on in 5 minutes, giving her like a warning. Here's our 5-minute timer. When it beeps, it's time to put socks on. Just thinking about like, how do we be proactive versus like waiting until that moment to try to respond? Does that answer your question?
It does, yeah. She's just
Okay.
been a
It's
fun little
hard.
lady. Because yes, we do
Yeah.
the warnings, and we have liquid
Yeah.
timers she can see. And I've used all of my teaching strategies and my
Yeah.
parenting. Yeah, it's just none of
It's
them
a
seem
lot.
to. But yeah, we've tried like little, like when she's in a fit, we'll do the play, and like we'll do the, at the role reversal, not in a mockingly way, but in a fun way.
Yeah.
And that makes her that makes her so mad.
Sure.
Like
Yeah.
some of those
Yeah.
things just seem to step, yeah. So we've tried a lot, but yes, we're
Yeah.
trying everything we can think of.
Well, and sometimes too, I think, and this is like a common occurrence, I think sometimes hearing those things, and for a child specifically, sometimes hearing those things in a different context can be helpful. So, like I'm used to hearing those things all day, every day from mom and dad, but now when I'm hearing them from someone else, I'll take it a little differently. And we can practice it differently when, it's hard to practice those skills when you're not in the situation. So, like I have a little peanut right now that cleaning up is hard. Cleaning up at home is really, really hard. But she cleans up so well in OT. Like you would never know that cleaning up is hard at home. And so before we practice cleaning up at OT, we run through the same things that I would instruct parents to practice at home. But in our context, obviously, she's not going to have the same reaction here because I am not mom and dad, and I'm not her comfort person. This is not her comfortable place. But by practicing using those skills and then doing the task and not having a meltdown here, that's decreased the amount and frequency of meltdowns at home because she's had the opportunity to see like, oh, I can do this. Like I can clean up, and you're right, it didn't feel like the end of the world. So sometimes just changing like the context can be helpful too, or changing the environment a little bit, but it's tricky.
Thank you.
All right, Hannah, I see you have your hand up. There we
Yeah,
go.
hi. I think some of what you just said kind of helped, but
Good.
sometimes I have an issue with knowing when to step in versus letting things run their course. So I know you
Yeah.
mentioned like let's not let things escalate to 100. Um,
Hmm.
but I get kind of like mixed feelings about, okay, should we just let all the emotions out and just let it kind of run its
Yeah,
course versus stepping in and even like making suggestions for, quote unquote cool down when
sure.
it's not received well or when it's like,
Yeah,
nope,
yeah,
don't tell me, don't touch me, don't do anything. So like
right.
when I guess when is it appropriate to kind of let things kind of just emotions just roll, you know?
I think like I always think back to function. Like if it's impacting their ability to do whatever it is that they actually need to be doing, like let's say we have a kid that really struggles with reading, and every single time the teacher pulls out this specific reading program or phonics program that they're doing at school, it's a meltdown, right? Or it's total avoidance. Um, that's going to catch up functionally. So they're going to lose practice at reading, and it's probably going to get harder and harder for them because we are now not practicing the skills. Um, versus like if I have a kid who won't put their shoes on, but we're trying to get out the door and we're having a meltdown about putting shoes on. Um, can I sit here for 5 more minutes? Like, do I have the time to sit here and let them have a big feeling about this? I do. Okay, well, then maybe we'll have a big feeling about this and we'll let this kind of pass a little bit more
Hmm.
before I start to jump in. I think though the key with all of it is that you're not trying to, in any situation, like by presenting strategies to help them regulate, you're not trying to stifle the emotion itself. you're you want to do it in like a validating way. So I understand, let's say, so we have a couple kids that really struggle with transitions, especially like out of sessions. So beforehand telling them like, I know it's so fun when you get to come play, and it's so hard to leave, isn't it? Like it's hard for me to leave too, and I don't like it when you have to leave, but here's what we can do when it's time to leave to help us, make it to the car and not lose it. So you're not invalidating the emotion, you're still letting them experience it, but you're teaching them that experiencing the emotion doesn't also have to come with this entire tidal wave of a reaction. So you're tying the emotion to a more appropriate reaction versus tying it to like an explosive reaction.
Yeah,
That makes sense.
yeah, that's so helpful.
And
Thank you.
it's just like kind of reframing, like the purpose of regulation strategies is not to change the emotion, it's just to change the reaction.
Yeah, sure. That's great. Thank you.
Mhm. All right, Candace, I think I unmuted you or tried.
Thank you. This has been wonderful. We are having some struggles with my son. I was just curious if you or any of the occupational therapists work with kiddos that have OCD as presenting as like the primary biggest difficulty in their
Yeah,
daily routine at this point, but it seems
yeah,
like the OCD, we've tried other treatments, therapy, medications, things like that, but it really seems to be more like his body tells him
mhm.
it just doesn't
We
feel
just
right.
can't. Yeah,
And
yep.
we can't get past that not right feeling. And I'm wondering if this is something that would be helpful.
Yeah, yeah. I think we all have experience working with kids that have OCD. There's kind of a cluster of like conditions that are considered like OCD, Tourette's. There's a few conditions that are all kind of clustered together in like a similar presentation, or similar like biochemistry, what's happening in the brain. And that's where the reflex integration stuff that we work on with kids can be really helpful, just because our brain is stuck in this fixed pattern of just like this reflexive cycle. And that's truly like what OCD is. It's a reflex, right? Like I have a thought and I can't do anything else until I fixate or I complete whatever it is that my brain is telling me to do. It's a reflexive response that we just can't get out of that pattern. So that's something we've seen a lot of success with when working on with kiddos. And specifically, we use something, it's an acronym, it's called MNRI. So it's Muscatova Neurosensory Motor Reflex Integration. If you look up MNRI online, their website is a wealth of knowledge. It's really helpful just in thinking about like, what does this even mean for kids? Like, what does this look like? They have a lot of really helpful videos and just different resources. But that's something that we would focus on a lot, probably.
Okay, awesome. That is super helpful. And I look
Yeah.
forward to connecting with somebody in the Des Moines area to
Yes. Well,
get
let us know
started.
if you have any troubles, but yes.
Okay, thank you.
All righty. Well, I think we made it through all of our questions. If anybody else has questions, feel free to email me. My email's up here. And like I said, these are all of our clinics with OT services. But thank you guys for all joining. And we will be sending out slides and hopefully the reporting here soon. So hope you guys have a great rest of your day and we'll see you guys soon.